My patient is 23 years old. He was a male. He came in for a head-to-toe assessment. So he had good gait and mobility, posture upright and straight, alert and oriented ×3, good nutritional status, access to 3 meals a day, and then BMI appropriate for height and weight, good health hygiene, or good hygiene. He was clean. No physical deformities or abnormalities. English is the natural language for him. He's in a good mood. He states he is happy. And then he has good gait and mobility. Now, for his skin, it was warm and dry, good hair distribution. Nail beds were clean. Pulses, the radial and brachial were palpable and intact. Capillary refill was less than 2 seconds. Face symmetrical, scalp clean, no infestations, no dandruff, denies tenderness to palpation, no lumps, bumps, or bruises. Temporal artery, no thrills. Maxillary and frontal sinuses, no tenderness. And then the neck, lymph nodes were palpable. His hair was clean and brown. So, sorry, I gotta sneeze. Oh, okay. Okay. Neck was symmetrical, no pulsations. Lymph nodes were intact and palpable. No tenderness, swelling, or enlargement in the lymph nodes. And no pulsations in the neck, no tenderness. It was symmetrical. Carotid arteries, no lumps or bumps, no murmurs or thrills. And they were palpable, and they were auscultated bilateral sides. Cranial nerve number 11 was intact. And then good range of motion in the neck, good strength in the neck also. And then for the eyes, the external structures, eyebrows, eyelids, eyelashes were clear without irritation. And then the conjunctiva was pink, sclera was white, cornea was round and non-concave. Pupils were equal, round, and reactant to light and accommodation. So, and then the external ears were without drainage or irritation, and no tenderness. The nose, a good patency, bilateral. The septum, midline, mucosa, pink. And then the nose on the outside was symmetrical. No drainage or irritation to the outside of the nose, so that's good. And then moving on to the lips, no lesions, cracks, irritation. In the lips, they nice and pink. The mucosa, teeth, gums, hard palate, soft palate, tongue, tonsils were clear without exudate, moist without exudate. Thyroid, not tender and not enlarged. Now the lungs, anterior and posterior, AP to T diameter was 2:1. The respiratory rate was unlabored and at 16. And then all lobes clear to auscultation, no tenderness to palpation, spine midline, negative to CVA tenderness, trachea midline, no tenderness. Now the heart sounds, supine, sitting, lying, and lateral were auscultated with no murmurs or thrills heard. S1, S2 noted. Apical pulse heard at the fifth intercostal space, left side at the mitral valve, and then regular rate and rhythm. Now abdomen, inspected it at eye level, good contour, flat, no striae or scars, no peristalsis, no pulsations, color appropriate for race. It was symmetrical, bowel sounds heard in all four quadrants, tympani heard to percussion in all lobes, and then light and deep palpations, negative in all lobes. So lower extremities, they were symmetrical, warm and dry, good hair distribution, color appropriate for race, no varicose veins, no edema, full range of motion in upper and lower extremities, and then good muscle strength in upper and lower extremities, and then the peripheral pulses, femoral, popliteal, dorsalis, pedis, and then posterior tibialis were all palpated and palpable. He had good hand grip. The heel to chin test was negative. Patellar test was positive. Scoliosis test was negative, and that was, I inspected his scapula, his elbow gap, iliac crest, gluteal folds, and his shoulders. And then cranial nerves 1 to 11, cranial nerves number 1 to 11 were all intact.